Hello. Welcome everybody. So glad to have you here. I am Sivan Purdue. I am an art therapist and a creative life engagement specialist consultant. And today I thought we would talk about, for our little chat, the difference between art therapy and art class. This gets confused quite often. I get comments about just coloring with people. You know, there's the coloring books that come out, saying that they're art therapy. I feel like there's a lot of confusion in this field, but it's important. And so the basic, very basic part, or the difference between the two, is art class is about the product. Art therapy is about the process, okay? Process versus product. When you are in art class, you're learning new skills. You have an educated teacher teaching you how to do things a certain way, look at things a certain way so that you can develop and create an expertise in those specific skills, whether it be drawing, painting, charcoal, whatever it is, right? And to develop your own style, but fundamentally, right, to learn how to use materials to create artwork that is pleasurable to look at, right? In art therapy, we also teach how to use materials, but the focus is on how to use those materials with confidence in order to express yourself in a way that allows you to process what's going on in that internal world, right? So it's about the process of using art supplies to explore, identify, and work through things in a therapeutic manner to get to the change you are looking for by going through therapy. Both, right, art teachers are now master's level required, or a lot of teachers now have to go back for those master's degrees. Art therapists are also that you have to have a master's degree in order to be an art therapist and go through a licensure process, whether that be in Maryland, where I am, we have state licensure. So in order to call yourself an art therapist or to be doing art therapy, you have to have this licensure that is regulated by a board with ethics, with all of that sort of thing, a standard of knowledge. In other states, there's a similar process that they might have with different licensure. It might be a creative arts therapist licensure, or whatever that state identifies. If your state does not have an art therapy specific license, then an art therapist should have, someone who's saying that they do art therapy, should have at least the board certification, or the ATRBC, right? Art Therapist Registered through the American Art Therapy Association, and then have their board certification as well. Some people choose to have the board certification, some people don't, but depending on your state, if they do not have those, they're not doing art therapy, right? They don't have the clinical knowledge and background to actually be doing art therapy. They might be using arts in a therapeutic manner, right? Which absolutely clinicians can do. I've taught other clinicians how to do it, right? They just can't say they're doing art therapy. There's a different level of treatment and process that goes through it when you're saying that you're doing or you're experiencing art therapy. Welcome to those who have just jumped on. I'm so glad you're here. Drop in a comment. Let me know who's here with me. And as always, if you have any questions, please put them in. Today we are talking about the difference between art therapy and art class. And if you're watching this on the replay, let me know. Again, I'm always looking for questions, suggestions of things to talk about. After this, my March schedule of things we'll be talking about in March on Tuesdays will come out, and I'm looking forward to having you. But going back to the difference between art class and art therapy, that's pretty much it, is basically the process versus product, right? I guess let me talk about art therapy coloring books that you see, right? Oh, Stephanie, hey, glad to have you. Let me know if you have any questions. Therapeutic coloring books, right? You can use art therapeutically at home. There's a big debate about whether coloring books are art therapy per se. Yes, I love coloring books too. Stephanie said she loves coloring books. They are a fantastic resource that I think has allowed people to engage in a hobby or an activity that reduces stress, that they find enjoyable, that lets them slow down a little bit, that before this whole thing of adult coloring books came out, either we never admitted to doing, which was me, right? Like, 'cause I love coloring. But it kind of gave us permission to do so. And with the adult ones, right, gave us more complicated designs to do, like the mandalas. And now they've got so many. I have this ocean one that I love that's almost too detailed, and then it's just frustrating. But you do whatever is comfortable. But I think it gives us permission to start creating this non-threatening artwork, right, or engaging in this non-threatening art making at home, whereas before that was more difficult. In order for it to be art therapy, you should be doing it with a licensed and trained art therapist. Now, using using artwork at home in a therapeutic manner, I think is fantastic. I love helping people do that. That's part of my work that I do as an art therapist, is hopefully get people comfortable with materials that they might not have used before, and then that helps them transition it from in the studio to home, right? I'm not really doing my full work if I'm not helping you take what we learn in the studio during our session home and utilize it as home as a means to support yourself. That's super important. Making it accessible, I think, is really important. In a couple weeks, we'll be talking about the importance of creativity. And that goes along with that, right? And creativity shows up however you need it to show up, which is cool. Welcome to those who just jumped on. I appreciate you. Give us a shout out and a hello and a question if you have any for what we're talking about today, which is the difference between art therapy and art class. That, I think, kind of covers it. It's a pretty simple one today. Not a lot of clinical terms or detail-oriented things to go down, to think of. But it's important to know. You'll also see wellness centers and places out there saying that they're offering art therapy. So I just encourage you to just ask, right? You wouldn't go to an acupuncturist who wasn't a licensed acupuncturist, or a physical therapist that wasn't a licensed physical therapist, that had to go through rigorous standards and exams and anything like that. So that's important. But if you love using artwork on your own to take care of yourself, that's amazing. And you don't have to see an art therapist in order to do that. That's kind of taking it to the next level. I would love to hear how you use artwork at home to help yourself and take care of yourself in different ways. And again, that can be a number of things. If we're just talking about artwork, there is the coloring book Stephanie and I both love. There's crocheting, there's knitting, there's quilling, there's needlepoint, right? There's carving, there's mini painting if you're into D&D and different things like that. There's a lot of things that you can do to express your creativity and to slow yourself down. That's kind of what it comes down to. Or part of it is being able to engage in the mindfulness, get into the flow of creating something, and slow down a little bit. When we create things and make things with our hands, we naturally produce dopamine in our brains. So it's a natural way to give us some dopamine and some endorphins and some of those good chemicals rushing through our brain, which is so, so important, especially now when we've been trudging through this really difficult time. So I encourage you to try something new. What's great is if you don't like it, that's okay. You just move on to the next thing. But be curious, play, allow yourself to explore, and I hope you have fun with it. Good seeing you guys. Thank you for joining me. I appreciate you so, so much. Next week, starting in March, we are going to be talking about when folks, our loved ones with dementia or Alzheimer's, have mood swings and how to manage that and why does that happen. And that's really difficult. So yes, we will be talking about that. No problem. Thank you, Stephanie, for dropping on. I appreciate you. And if you have any questions dealing with mood swings with folks with dementia or Alzheimer's, please let me know. I will make sure I touch upon them. But this, I know, is a really tough one for caregivers and loved ones of folks with just this disease to deal with sometimes. It's hard. So I look forward to chatting with you then. I will see you next week. Take care. Bye-bye.